name's Ryan Dump. I'm a licensed clinical psychologist. I am the owner of Resilient Psychological Services, which is a private practice outpatient therapy facility in Chicago. We're in the River North neighborhood. We have 9 therapists on our team, and we work almost exclusively with adults. Individuals who are in their 20s, 30s, and 40s are pretty typical caseloads.
Okay, great. And how did you get into practicing?
Sure. Of course, that's a loaded question. We all have sort of our journeys and our histories, which lead us to this place. For me, I've always enjoyed connecting with people, appreciation for the human condition and the suffering that we go through, and the power of connecting, the power of being able to be heard, be seen, and be understood. And that's what our work is all about, is hearing people and connecting with them.
Yeah. I'm so grateful for the work that you do, and for all mental health practitioners. Truly, it's so needed.
Thank you. People have been saying that more lately, and I'm working on hearing it and really allowing that, the gratitude to come in. I think for many of us right now, we're kind of getting through our days, and it's sometimes easy for us to dismiss the impact of the work that we do.
Absolutely. And tell me a little bit more about your practice. What services are you offering right now?
Sure. We're really fortunate that as a profession, we're able to do what you and I are doing right now. We're able to meet virtually. And I had some reservations at first. I wasn't sure, with the work still is good, found to still do some pretty good work. We've had fewer referrals come in over the past few weeks than we have in the past. I think a number of people aren't aware that this is something that is available, or it might be that other life stressors are sort of put to the side and everyone has quite a singular focus right now. So we've noticed a significant drop off in referrals, yet for the most part, we're able to keep our caseload as it is, which I'm really thankful for. Most people are also agreeable to meeting virtually, like through teletherapy.
Yeah, it really is important to highlight the service that you're offering, because so many people being stuck at home, and kind of stuck alone with their thoughts, at least have someone like you and the people at your office. Now, how many practitioners do you have at your office?
There are 9 of us at the office.
Okay, and what would you say your ideal client is?
One of the things I like about our practice is everyone is so different with what our areas of specialty are. And with that, one of the things that we're all similar in the sense that we're leaders in a number of ways. And so each of the different therapists are similar enough that we get along well and we could cross-refer. Yeah, the specialty areas are different. So we all work with depression and anxiety, things like ADHD, individuals who have histories of trauma. These are all pretty common. And then we all have individual more specializations, things like health psychology, things like sexual orientation, gender identity issues when those come up, some family therapy, couples therapy. So each of us, again, individually has specific specialties. Yet across the board, we all work with more general concerns that most of us be going through on a more day-to-day basis.
Yeah. And what type of therapy do you usually use in your sessions?
Can you ask the question one more time?
Yeah. What type of tools, techniques, or therapy specifically that you use in your sessions?
Yeah. So specifically for me, it's difficult sometimes to answer this question because what's really important is that I'm myself first and foremost. So I use myself quite a bit as a tool. And with that, it's the empathy and the compassion that come through in the relationship that exists between a client and a therapist. That's first and foremost. And I use a lot of what we'd call third wave CBT. And so this focuses on being very mindful about kind of what's going on within us, both within us in terms of like physiological sensations, the emotions that we're experiencing, any thoughts that we're having, and then working to accept and make room for those feelings. And so happen just through dialogue, sometimes through more like thought experiments and sort of rehearsing maybe something from the past that's come up or something that's going on in the present. My practice specifically, I don't do a lot of homework or paper, pencil. I might give more exercise to do. If somebody's having an anxiety, as an example, one of our favorite things to do with anxiety is avoid it. And so the homework might be to actually confront that anxiety or to expose yourself to it.
Okay, I see. Can you give me an example of that?
Sure. Right now, so many people are having anxiety about what's going on with the pandemic. Is the possibility that we ourselves or a loved one, friends or family might, have exposure and contract it. And so people are talking about, well, I'm not at risk, or I'm in an age demographic which doesn't put me at extreme risk. And we might even use exposure in the way there where we would acknowledge it's possible that I or somebody who I care about could contract the virus. And it's possible that I or someone who I care about might have significant complications because of that. And for some people, even that thought, even though we're not tangibly exposing them to anything, even the thought can be overwhelming. So what we'll do is we'll sit with those thoughts, as uncomfortable as they are, increasing that level of comfort and tolerance that might seem to be too overwhelming. So what we're borrowing from is the same type of treatment we would do when someone has a phobia or something like obsessive compulsive disorder, where we expose that person to the thought or the experience that makes them uncomfortable. And we don't like uncertainty. Part of being human is to not like uncertainty. We like our world to be black and white. We like to have answers. And what we do, at least in my office, is we work at being more tolerant for what I call the gray, and more tolerant of a position without certainty, because right now we don't have certainty. We have a lot of questions. We have questions of, when will this end? Will I be okay? Will my family be okay? Am I going to be able to pay my bills next month? And when we're asking those questions, right, we're asking questions, and questions elicit answers. Again, we don't have those answers. So what those questions do is they elicit sort of a pattern or a cycle of thoughts. And those thoughts, as they begin to continue, they get faster sometimes and faster, and there's no end point. And so what I work on with folks is to reduce or sometimes even eliminate the number of questions that they're asking and turn the questions into statements. And so by making a statement, what we're doing is we're making room for whatever thought or emotion, whatever sort of experience we're having. We're making room for that. We're able to sit with it. So if I ask the question of, when will this end? I turn that into a statement of, I don't know when this will end. And as much as that might elevate me or someone else, I'm learning to increase my tolerance for that. And if I am wondering, will so-and-so be okay? I'm turning that into a statement, an exposure statement of, I don't know if so-and-so will be okay. And I might even go so far as to label what's happening within me. That makes me nervous. That makes me scared. I don't like that I don't know. And all of those, again, are just statements, and they keep us grounded. And again, we don't sort of begin the cycling of asking questions. We don't begin the cycling of creating answers, because if we try to create an answer to that, right, will so-and-so be okay? Well, we're not going to want to say no. Also, we don't know that to be true. So we're likely to go yes. We're probably going to label it as, yeah, of course they're going to be okay. As soon as we label something, what I call a falsity right here, will they be okay? Again, we don't know that to be true. We have a voice over here that will actually highlight that. Well, you're saying they're going to be okay, but you don't know that. And then there's a back and a forth. So it may no longer be that cycle that happens with the questions, but now we have a back and a forth. And again, that leads us to feeling very unwound, very ungrounded. So instead of even engaging the questions or the back and the forth, we encourage people to sit with, I don't know if they will be okay. And that scares me.
Yeah, thank you. It's powerful. Right.
It's very difficult to practice. It takes a lot of repetition. Sometimes it takes a space like this to, it's sort of like going to the gym or having a coach if we're exercising. It's helpful to be at the place where you have somebody sort of facilitating that process, because at home, many of us aren't going to want to put ourselves in that sort of vulnerable position where we acknowledge the truths, where we acknowledge that we don't know. We're more likely to engage our defenses, maybe create some sort of a narrative that provides us with comfort, even though it may not hold true.
Right. And what advice would you give to anyone at home right now to remain calm, or any general tips?
Sure. First and foremost, right now, it's important that we're taking care of our health and our safety, and to focus on what it is that we have control over. So we have control over ourselves, not our friends, not our family, not our roommates. We have control over ourselves. And so, are you doing things like engaging in social distancing? Are you staying home? Are you limiting your exposure, not going out more than is needed? And then as we move on from sort of like the bottom tiers of health and safety, are we talking to our family and friends? Are we taking care of our minds? Are we taking care of our bodies? Are we getting enough sleep? Things like that. Again, all things that we have control over, things that we have influence over, and being able to sort of have boundaries so that we're not concerned so much about what it is that others are doing. We can let them know, hey, I'm concerned about you, or hey, have you read this or thought about practicing this? Really, though, focusing on what it is that we have influence and control over.
Yeah, thank you. What are your thoughts on the news and media in mental health?
Sure. It's very easy for us to become obsessed right now. There's constantly new information, which is interesting. As I say new information, I'm not so sure that it is new. There's constantly information. And speaking for myself, I know I'm on this never-ending quest to find more. And it goes back to what I was talking about with anxieties, because I want answers. I'm having difficulty, sitting with the uncertainties. So I'm seeking additional information, hoping that it will arrive at some answer. So there certainly ought to be sort of a self-imposed limit on how much news and social media specifically that we expose ourselves to. It's very easy to get information and misinformation and interpret that information and sort of engage in those patterns I was talking about earlier. So especially news that's informative about how to stay safe is important, though while the news has changed, sometimes it feels like minute to minute, hour to hour, many of the guidelines that have been put in place haven't necessarily changed. So there's not a whole lot of need for increased exposure to news sources right now.
Thank you. And then if someone is at home watching this, when is a good time for them to seek therapy or seek services that you offer?
Sure. So first off, through social media right now, if you happen to be able to get access to anyone who is a mental health provider, there's a lot of sort of at-home self-help tips, whether it's in the form of photos and pictures on Instagram or online articles. There's no shortage of information to help yourself at home right now. If someone is looking to get into therapy, go to your favorite search engine and type something in. You're going to find a list of therapists around you. Specifically, I like using therapyroad.com, full disclosure. That's something I've developed for the purpose of finding a therapist. And in terms of access, there's no shortage of access to therapists at this point. Okay. You asked a question, Dr. Felty, about when's a good time.
How do they know? Like, okay, I really think that therapy would benefit me now. Like, I've already been on social media. I've been trying to do all this self-help. Like, what would you say is, okay, if you're dealing with this, you should reach out for help?
Yeah, the question of, even something like, is therapy right for me, is probably a question that we could answer if you're having that question or that curiosity. If you're having a desire for change, I often will say that no one needs therapy. And I'll also say that we don't help those who need help. We help those who want help. And so if you or anyone is in a position where you're having difficulty with the uncertainty right now, you're having concern, we're not going to be able to give you answers. As therapists, we're not going to be able to make those anxieties and those fears go away. Those anxieties and fears are actually what are keeping us safe right now. If we weren't concerned about our own health or health of others, we wouldn't be compliant with the guidelines that have been suggested. And so we're not going to help for the anxiety to go away. We will help you, though, to increase your tolerance with it. So if you're finding that you're thinking about friends and family and yourself, or the economy or your job more than you'd like to, a mental health professional can certainly help with that.
Okay, thank you. And what is the contact information of your office in case someone wants to reach out for help?
Sure. So our website is resiliencechicago.com. And you're going to test me on this one. Our phone number is 312-600-3935. And from there, people can be directed to a specific therapist or our central intake line.
Okay, great. Thank you. Anything else you'd like to add?
This is an interesting time. I have heard the term silver linings so many times in the past few weeks, and I'll tell you, it's a term that I typically stay away from because I look at a silver lining as a justification or defense mechanism that we'll often use to sort of deny something bad that's happening in our life and just focus on the silver lining or the good. Though I recognize right now that there are many silver linings that we're seeing, and especially as we're sort of getting away from our day-to-day, a lot of our values and our priorities are rising to the surface, and it's sort of like a soft reset for many people, and they're able to focus on their values, focus on priorities, whether that be health, creativity, family, friends. Of course, we're not seeing people in person as much. It's still, it is an opportunity to step away from the day-to-day. And while we're in this, I would encourage people to, first and foremost, health and safety are priorities 1 and 2. And you can begin to practice your values and focus on some of those priorities that you may not have access to otherwise.
Great. Thank you so much. I really appreciate your time.
You're welcome.
And I hope you continue to stay safe. And thank you again for helping people.
Of course, you're welcome. Thanks for all that you do and for getting these messages out to people. And you ask, seeing you outside, it's great. I speak with people who are saying, well, we're locked in, and I'll remind them, you can still go outside. And that's important to be doing as well.
Yeah, absolutely. Well, have a good day. I'll talk to you soon.
Thank you. Same to you.
Yep. Bye-bye.
Bye.